Good morning. So my name is Lilian Mumina. I'm a registered clinical nutritionist, and I have personal interest when it comes to weight management and obesity. And together with my counterparts, James Otieno and Grace Nyawira, we decided to do this topic on harnessing gut health optimization to prevent obesity. That is basically a nutrition-centered approach for optimizing gut functionality in preclinical obese patients. So next slide. So before we go to the background, maybe I can give you a small history. We have seen a lot of rise in use of this pharmacological use of medication. It is a current trend in Kenya where we are having people self-medicating and you're having everyone out there prescribing them. And in the name of, or in the quest of chasing a slimmer or a thinner waist. And this is basically due to the trends that we have observed where we have global obesity rates actually increasing and tripling since 1975 to the current century. And we all know as nutritionists that the gut microbiota plays a critical role in nutrient metabolization, hormonal regulation, and energy balance. And this biosis that is basically altered gut microbiota contributes to inflammation, impaired satiety, signaling, and metabolic disorder. And early nutrition-based intervention targeting gut health may prevent the progression from preclinical to clinical obesity in humans. So this is basically a rough statistics of the obesity situation in regionally in Africa and in Kenya, as we have seen recently. The Ministry of Health, through the Cabinet Secretary, recently gave a notice on the increasing prevalence of childhood obesity. And there was also a research that was done recently that showed that more than 43% of urban women in Kenya are currently overweight and obese. And this highlights the importance of actually now looking for simpler it's not simpler, but cheaper or better preventive mechanisms when it comes to managing obesity. This is basically a image or a representation of the global obesity prevalence on how we have actually come from, even from us as a country. The other day we were being asked if we have the time to actually take care of our health, and most of us would actually say no. They will give a lot of excuses. And as we know, if you're not physically active, you're eating badly, you're not taking care of your gut, you're definitely going to gain a lot of weight. Next slide. So these were the objectives that we came up with, the main one being to examine the effectiveness of gut health gut health approaches as a cheaper alternative to preventive and management of both preclinical and clinical obesities. And the other objectives included to synthesize evidence from 2013 to 2025 on the relationship between gut functionality and weight regulation, to identify nutrition-centered strategies that restore gut functionality and support weight management, and to propose a practical dietitian-led protocol for preclinical obesity in Kenya. We don't have one currently. The next one. So the design that we used was narrative literature review, because we were basically using database from PubMed, Cochrane Library, and Scopus, and any other relevant data that we will come across. And some of our keywords will be gut microbiota, short-chain fatty acids, dysbiosis, obesity, prebiotics, probiotics, and nutrition intervention. And the inclusion criteria was on human studies, meta-analysis, and mechanistic studies that link gut composition to metabolic functions and weight outcomes. So the key findings were reduced microbial diversity and altered firmicutes or bacteriocytes. That is basically the good and the bad bacteria ratios actually are very prominent in preclinical or obese patients, and dysbiosis correlates with inflammation, impaired short-chain fatty acid production, and decreased basal metabolic rate, leading to the increased weight. And of course, gut-deprived peptides, that is the GLP, and microbial metabolites regulate appetite and satiety through the gut-brain axis, and nutrition interventions such as increased dietary fiber of roughly between 25 to 38 milligrams a day fermented foods and polyphenol-rich plants improve microbiota, diversity, short-chain fatty acid synthesis, and metabolic outcomes. So this is just a rough estimate of how we are doing as a country. Of course, in Kenya, more women are more obese than men, and this is just a projection from 2014 to 2022, according to the Kenya Demographic Health Survey. But of course, the numbers might be higher because we are known to, I don't want to use the word cook, but we are known to actually just use data from our offices or our boardrooms to come up with statistics and then do a good presentation on them that do not actually depict the real picture of the situation on the ground. The next slide. So why is this relevant, or how can it be relevant to the policy? Because when we focus on nutrition support, it can actually aid and help in obesity prevention that is drastically rising in Kenya. Of course, if you compare with other developed nations like the Western nations, the Europe, the USA, the American and such, of course, the numbers might look significantly lower and they might look like they are not an emergency. But those, if you check on the trends from where we are coming from and how we are going and what we are doing, then this is the right time to actually make sure that we implement or we focus on championing for implementation of such inclusion of nutrition, gut-focused intervention in management and prevention of NCDs in Kenya. And of course, this also aligns with the National Nutrition Action Plan for NCD reduction. Next slide. So these are basically the proposed dietitian, where the clinical nutritionists now come in with the interventions, where they'll do a baseline. Of course, there's also in the intervention and what will be monitored. And of course, we have the anthropometrics being some of the indicators for the baseline. And for the intervention, we have gut health, stool quality, movement, and adherence support. And of course, we monitor on weight, satiety, and metabolic markers. Next slide. So this is a visual representation of the impact of dietary fiber on gut microbial diversity, where we have consumption of low fiber diet actually been associated with imbalances, like we have a small percentage of the beneficial bacteria and of course an increased number in the potentially harmful bacteria, and the neutral bacteria actually being lower. And then we have also with the high fiber diet, high consumption diet, that is basically the use of good foods, the good bacteria actually increase, and this has actually been shown to have a positive impact when it comes to metabolic regulations. Next slide. So these are the practical implications. I've just heard Dr. saying that we don't give recommendation before we conclude. So allow me to just do that. So we need to champion for improved financing in nutrition in Kenya and promote and support gut-oriented research for nutrition program. Next slide, because my minutes are running. So this is the conclusion and the way forward. We have to optimize gut functionality, as it has been shown to improve metabolic function, metabolic health, and prevent obesity in our population. And further Kenyan-based pilot studies are actually recommended because they are missing when it comes to gut health. And of course, we call for multidisciplinary collaboration that is basically between dietitian, clinician, physicians, and others, so that we can actually be able to prevent or to curtail the increase in numbers. These were our references. And yeah, the authors of this were myself, Lilian Mumina. We have Grace Nyawira Njuguna, and we also have James Otieno. And of course, questions are welcome.